Time management as a new nurse. What is good, you guys? NWA here, Nurse Pat. We got some new heat for you guys today. Got a comment suggesting that I talk about time management as a new nurse. This is important because this will make your shifts much more manageable, more efficient, and less stressful. You don't want to be all unorganized, all over the place, you know what I'm saying? Because if something unexpected happens, and which it will, you don't want to be caught with your pants down.
Surprise, motherfucker.
You gotta live by the 5 P's. Proper preparation prevents poor performance. You gotta be prepared, not surprised. You need to be able to time manage while be able to have a little bit of wiggle room in between just in case something happens. These type of anomalies in your shift can be stressful. Your shift will never go perfectly as planned. That's just not how nursing works. Now, as a new nurse or a new grad, time management and prioritization sort of go hand in hand. They're not the same, but they do complement each other. So, in the beginning of your shifts, you look up your patients, right? Or at least I hope you do. When looking them up, you should at least be able to get a little bit of an idea of how your workflow is gonna go for the day. I'd say pay attention to these 3 things: medications, orders, and assignment flow. For medications, know which ones are time sensitive. Your narcotics, your benzos, your antibiotics, anticoagulants, insulin, etc., right? Anything that is not time sensitive, don't sweat it if you gotta retime it. I know nursing school, oh my god, it's not on time, med error, oh my god. No.
I don't give a fuck.
It's really not that serious if you need to retime a patient's daily stool softener or their daily Lipitor. Try to cluster your meds and your care as much as possible so you don't have to be going back and forth in the room multiple times. Now with your orders, you gotta think about what specific doctor orders need to be done and are time sensitive. For instance, wound care orders, blood sugar checks, interventions, and preparing for upcoming procedures such as, an OR, IR, cath lab, stress tests, CTs, PET scans, you name it. Now that you know your important time sensitive meds and orders, you could cluster them and sort of plan things out that way. Assignment flow. Do you have any upcoming admissions, discharges, transfers, post-ops, etc.? Try to get those time-sensitive medications and orders in check before having a new patient or discharging, transferring, whatever, right? Because when you get a new patient, especially admission, you're gonna be stuck in that room for quite a while. Now, we have to talk about asking for help and delegation. It's important to have good rapport with your coworkers. If you're nice to people and you help others, they should be able to help you out as well. If you're not nice to others, what makes you think that they're gonna help you when you're drowning?
No.
It's impossible to be 2 places at once, and you're gonna find that out many times during your shifts. If one of your patients needs help and you're stuck in another room, then ideally you should be asking for help from your breaker resource nurse, charge nurse, or any colleagues that might be available. Just be courteous about what you request and don't be asking people to do stuff like enemas or suppositories for you, okay? That's not something you ask a break nurse or resource to do. That's just disrespectful.
Are you crazy?
As a new nurse, you're gonna have to delegate with your CNAs. And I know it's difficult. For me, when I was a new grad, we're not used to telling older people, especially those who have been working for quite a while, what to do. Learning how to phrase your delegations is key. Rather than demanding a request, you gotta phrase it as if you're asking for their assistance. What sounds better?
Wait, Esmeralda, what are you doing?
Oh my god, vital signs, vital signs.
Patient over there. It's bowel movement. She's stinky. You clean her.
Or, hey Esmeralda, are you free to help out room 32? She sorta needs a diaper change at the moment and I'm a little tied up with another patient. First one is bossing around. The second one is asking for help. You gotta be nice and helpful with these people. They can really make or break your shift. Of course, they are CNAs, so they're technically your assistants, but that doesn't mean you gotta think of them as beneath you. They're there to help you and work with you as a team, and they're amazing at what they do. They be changing diapers, sheets, transfers with the quickness. Like literally, I remember when I first started, I was like amazed. They're like We'll turn the patient. Clean, clean, clean. Swag cut. Roll up the sheets. Log roll. Boom. Clean up. Boom, boom. Zinc spray. Boom. Quick. Right? I was like, I didn't even do anything. So of course, not every hospital is gonna have great helpful coworkers and great CNAs, unfortunately. And maybe that might mean you gotta look somewhere else. You're gonna be miserable out there if you don't. Nursing is not something you should feel like you're a one-man army, right? Nursing should be something where the whole unit works as a team and helps each other out. Well, there's so many things I could talk about in regards to time management, but these are some key fundamentals I feel like you guys should work towards first. You know, I know being a new grad is tough, and for most people, when they're orienting and starting off, they question their career choice. But once you're more comfortable, the job will be a much more enjoyable and manageable experience. So yeah, I hope this helps you guys out. Comment, like, and subscribe if you're feeling this type of content. As always, stay safe, stay humble. I'm out.